Cuttack, a densely populated city with poor sanitation services and a lack of a micro-planning approach, was struggling to provide good living conditions to its slum population. In March 2021, a new partnership was forged between the marginalized community, Ernst & Young or EY, Center for Advocacy and Research or CFAR, and Cuttack Municipal Corporation or CMC to initiate an inclusive sanitation project in 8 slums of Ward 21, 22, 26 and 27. For the first time, a strong leadership emerged at the community level with the ability to engage with local service providers and the urban local body to strengthen sanitation services and practices.
As far as behavioral change is concerned, without an impetus from the community, people would not change their routine. So along with IEC, involvement of local leaders, local stakeholders, SHG groups, then all other slum development associations, all of that is very essential, and that is what we have also been targeting through various schemes.
Much of this can be credited to the leadership provided by both CMC and the community. Let us revisit the journey and learn how the community prepared itself at many levels. Community empowerment and water, sanitation and hygiene. Step 1, shared vision. Step 2, organic leadership. Step 3, an organizational structure. Step 4, building community platforms and community structures at slum, ward and city level. Step 5, forging collaborations with the stakeholders. Step 6, resolving short-term, medium-term and long-term issues together. When the vision of the project was first formulated, everyone realized that this initiative will create new opportunities to achieve inclusive sanitation. Later, community management groups or CMGs were set up to lead the process at the community level. More importantly, representatives from excluded communities, self-help groups or SHGs, and Mahila Arogya Samitis or MAS were included in these groups. Subsequently, selected members from the CMGs were federated into gender forums that managed the Gender Resource Centers or GRCs at the ward level. And under the leadership of the Commissioner of the CMC, the GRCs helped in establishing multi-stakeholder convergence to address the targeted community sanitation challenges. Both the CMGs and the gender forums that staff the GRCs worked at the household, community and service provider level to address the key sanitation-related gaps and concerns identified in the community.
Women are involved in any movement, the movement will not be a success because they actually lead the community in changing the behavior starting from their children, their dependent population, and at the community level women have a larger say, and changing the behavioral pattern of women will actually lead the community to sustain the change in the long run.
The CMC not only campaigned to generate demand, but also to create scientifically sound waste management practices. With the support of Swachh Sathis and CMG members, settlement-level awareness drives were initiated to segregate both wet and dry waste from the source. Also, wastes were routinely collected from every doorstep at a scheduled time.
से माउसी अलिया नापी आसते किसी लोक अलिया दौले आ कि लोक दौन कि जिते सीआरपी दीदी मैंने आसिले आमको अलिया विषय बुझेले ओदा अलिया सुखिला अलिया अलग अलग करने कहले से आमर एसएचजी ग्रुप्र समस्ते बसी समस्त को बुझे घरे घरे समस्त को बाल्टी दे बुझेला समस्ते ओदा अलिया और सुखिला अलिया अलग अलग कर रखिले.
The waste collected from settlements was immediately moved to the micro-composting centers or MCCs for further segregation, treatment and value addition by the SHGs. By creating livelihood opportunities, this collaborative process provided safety nets for women and transgenders during the COVID-19 pandemic.
जे आम गोटे आगुरी कॉन्फिडेंस ना लेवलटा बहुत कम थिला एबे कॉन्फिडेंस आसी जाइछि जे आमे भी किछि करि परिबु लोक को मुह देखा लाज लागुथिला केवल भाबुतले ए भिक मागी बा रास्ता कोरे ठियो छ हमको किछि उपाय नथिला एबे बे मेनस्ट्रीम हेई परनु आ लोक को हम सहजरे आ बहुत भला बारे भी आपने नेलेनी.
One of the major learnings from this initiative was anything done collaboratively is more likely to succeed than done alone. The CMC not only enabled the community to use toilets but also collaborated with CMGs and youth clubs in regular monitoring, repairing and construction of women-friendly community toilets.
ମାନେ ବହୁତ ଲଜ୍ଜା କରୁଥିଲେ ସବୁ ବାହାରେ ବସୁଥିଲେ ଝିଅମାନେ ଆଉ ଆମର ସ୍ତ୍ରୀ ଲୋକମାନେ ଛୁଆମାନେ ସବୁ ବାହାରେ ବସୁଥିଲେ କିନ୍ତୁ ଏବେ ଯେବେ ଲାଟ୍ରିନ୍ ବାଥରୁମ୍ ସବୁ ଭଲ ହେଇଗଲା ଆମ ସାହି ବସ୍ତି ପୁରା ପରିଷ୍କାର ପରିଚ୍ଛନ୍ନତା ହେଇଗଲା ଏବେ ବହୁତ ମାନେ ଖୁସି ହେଇଛନ୍ତି ଆମ ସାହି ବସ୍ତି ବି ବହୁତ ପରିଷ୍କାର ପରିଚ୍ଛନ୍ନତା ହେଇଯାଇଛି.
Simultaneously, the sanitation workers and residents from these settlements were sensitized about mechanized desludging and the importance of periodic sludging. It was found that all the targeted settlements in the city were located near open drains and were cut off from the rest of the settlements for weeks during the monsoon season. To get rid of these persistent problems, CMG members from these areas met the sanitary inspectors and submitted applications for regular declogging and desilting. As a result, not only were drains regularly cleaned, but they were also completely covered for the safety of the community in Pithampur. Meanwhile, adolescents and women from Jhola Sahi, Dhobi Lane and Puri Ghat were oriented on menstrual health and hygiene management and the importance of the safe disposal of napkins.
आगरे आमे जानि नथिलु कि नैपकिन ड्रेन रे पकई दउथलु एणे तेणे फोपाड़ी दउथलु जेबेठु आमे जानिलु ए जो मैम माने आसी कि मीटिंग करथिले सेई दिनटु आमे जानलु तो सेई दिनटु आमे कागज रे गोडे पॉलिथिन रे बांधी अळिया गाडी आसिले आमे तांको सखाळे दे दउछु.
The concept of Sani Wall or community dashboard was used to make all stakeholders committed and mutually accountable. All information and data on water and sanitation services are now displayed in targeted slums. The data on Sani Wall is updated every week, thus ensuring community ownership and inclusive wash for marginalized and excluded population in Cuttack.
जदि एकता न होबा आमे जदि म्युनिसिपालिटी पाखरे प्रतिवाद न करिबा आमर जदि आपत्ति अभियोग को उपस्थापन न करिबा सरकार कोन प्रत्येक घर प्रत्येक साई के जाई कि एटा बुझिबा संभवपर नुहे तेणु करी आमे एकता हेचु आगामी दिन रे हबु आमर समस्या को सरकार पाखरे उपस्थापन करिबु ताकू समस्या को दूर करिया पई चेष्टा करिया पई आमे संकल्पबद्ध भाबरे रहिछु.
Undeniably, Cuttack can be considered one of the front runners in implementing a gender-inclusive sanitation model. Today, the critical need is to join hands and mainstream this model in other cities.